Hi there, hello. Yes, my name is Dr. River. Nice to meet you. So I see here on my plate that you're for a cranial nerve exam, is that right? Okay, great. Before we get into the exam, I would like to ask you some simple questions that could be of use in the future. Alright, great. Let me just put on my glasses. I'm getting a little bit older nowadays. So first, your name. Yes, also your last name, yes, alright. Great, thank you. Your date of birth. Oh, that is a lovely date if you look at the numbers. Yeah. Your height. And if you're not sure, just an estimated number. Yeah, okay. Your weight. Oh, that's a completely normal weight. Yeah, it's fine. Now some questions relating to your past. Do you have any allergies, maybe? Okay, yes. No, it's completely normal, really common. Do you use any medication? Okay, yes. A question about your diet. Do you have like a balanced diet or? Yeah, okay. Do you exercise regularly or once a week? Never. Oh, okay. And do you have any drinking, drugs, or smoke problems? Oh, that sounds completely fine. I also like a drink once in a while. And now just your address, if like we need to send you something, just so that we know where to find you. Okay. Do you have any questions relating to this exam or anything else you would like to know? No? Alright, great. Now we have everything we need to know and we can get into the examination. So, cranial nerve exam is all about to see your responses, especially with the 5 senses, your sight, your hearing, your smelling, tasting and your feeling. So I want to start with the eyes. As you can see, I wear glasses, but I'm not seeing them on your eyes, so I will put them off as well. And I want to start with a very basic test, just simply following my finger. Yes, okay. So I will put them in and out of your focus and just concentrate on the finger and follow it along, okay? So first out of focus, okay. Yes, focus on the finger. Okay, again. You're doing it really good, yes. Okay, now we go the other way around. Yes, and one last time. Alright, so now I will go up and down with the finger and you just have to do the exact same thing, just follow it, alright? Okay. Alright, great. So what I want to do now is I want you to focus on my nose. Just look at my nose. I know it's a weird nose, but just focus on my nose, this little thingy over here. And I will put up my fingers and I will move one. And you have to tell me which one is moving, my right finger or my left finger, okay? So focus on my nose, right here. Okay, let's begin. Focus on the nose, alright? Good. Yes. Okay. Yeah, I was fooling you, eh? Yes. Okay, one last time. Great. Yes, I will be taking some notes during the exam, just to make sure we check everything and everything is completely fine. Okay. Yes. Okay, so now I will be using this flashlight to check your pupils, see if they have a good reflex and to check if everything is completely fine inside. So first I'll just have a quick look into your eyes. So just open up real wide and let's see. Alright, that eye looks completely fine. The other eye. Yes, also completely fine. Alright, so what I want to do next is I will move the flashlight from left to right, up to down. And you just have to follow the flashlight. In the meanwhile, I'll be looking at your pupils to see if they have a good response, good reflexes. And yeah. So just simply follow the flashlight. Alright, so everything seemed completely fine, nothing out of the ordinary, nothing that needs to be checked. So that is really great. I'll just make a quick note. Yes. Alright, so next part we'll move down and we're gonna go to the nose area, to your smelling sense. And I have 4 different bottles with something in it, and you just have to smell it and tell me what you smell. Some are really overwhelming, like you just take a really small sniff and like your nose is full, and others you really have to take a deep smell in order to smell it. Right, so the first one I want you to smell. Yes. Take a good sniff and tell me what you smell. Yes, that is actually really good. It was lavender, and I'm really, really good job there. Right, so the next smell is actually pretty overwhelming, so don't stick your nose into it immediately. Maybe use this movement and take a smaller sniff. Yeah, this is alcohol. You did a really good job. Yeah, great. Okay, so I have 2 more. This one is also a little bit overwhelming, so be aware of the smell. Yeah, really, eh? Yeah, I know. Yeah, it's garlic. It is really in your nose. And the last one is actually quite nice after the garlic one. Yes, mint. I also really like the smell of mint. So you did a pretty great job at that. I think your nose works completely fine. Again, a quick note. Alcohol check, garlic check, lavender check, mint check. Great. So next one, we'll move to your ears on the side. What I will do is I will make some sounds with my hands, see if you can like pick up the sound wave, and I'll say some words and I would like you to repeat the word so that I can see if you like hear what I was saying. But first I'll check again with the flashlight. I'll take a quick look in both of your ears to see if there's anything wrong, or maybe if everything looks great. So I'll just move to the side very quickly. Can I have a quick look? Yeah, so this ear looks completely fine. Fantastic. Your ear looks great. So the next ear. Yeah. Both of your ears looked completely fine. So now I'll just make some hand movements and see if you can like hear it. Alright. Yeah, you picked it up. Yeah, I was just making like this movement with my hands. Okay, so I'll make another. Let's see if you hear this. Yes. Alright, great. So now I'll just say a word in one ear and a word in the other ear, and I want you to repeat the word after me, alright? And it will be very silly words, so try not to laugh. Maybe I will, but my apologies, alright? So first words, and I'm sorry, I am gonna come a little bit closer, alright? Peanut butter. Peanut butter. Peanut butter. Yes, correct. I said peanut butter. Alright, so now I will say another word. Chocolate. 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 Yes, correct. I said chocolate. So now I will do it again, only a bit softer. So it will be a little bit harder to hear the sound. Sleep. 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 Yeah, you're actually really good. Yes, I said sleep, so that is right. One last word. Pen, 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 pen. Yes, correct. I said pen. Just make a very quick note. Your ears looked fantastic on the inside. Actually, they really did look fantastic. You heard the hand movements and you repeated after me, so that is completely fine. So that is really good. So now we are gonna go into the tasting section, so with your mouth. And I will first check your mouth on the inside to see if there's anything swollen or if there's something that is looking a little bit more red than the rest. But for that I will use again the flashlight to really look into your mouth. So you might want to open your mouth really wide so that I don't touch anything inside that makes you wanna reflex in a way that we would not like to happen. I'll just put up my glasses really quickly so that I have a better look, and just open your mouth like really wide so that I'm able to have a clear vision and I won't be bumping into any teeth or something, or your tongue. So open up really wide. Yes, great. Just have a quick look. A little bit wider, please. A little bit, yeah. Alright, this is great. Thank you. Yes, alright. So everything looks completely fine in your mouth. Really good. And now we're gonna go to the tasting section. I have 2 liquids and I have 1 hard part. So we're gonna start with the hard part. I want you to take a little bite of it actually and tell me what you're tasting. I promise you it's not a gross taste, so you won't be having any nasty aftertaste, but take a little bite please for me. Yes, okay, and tell me what you are tasting. Yes, mint. Alright, great. And so now I have 2 liquids. Also actually quite a nice taste. I just shake it up so that the molecules are like really shake it. And I'm going to open it and I want you to stick out your tongue, and then I will let a little bit drop on top of it and you can taste it. Alright, so stick out your tongue and I'll drop a little bit. So tell me, what do you taste? Yes, banana. Oh, you don't like bananas? Oh, I'm so sorry. Well, I hope that you won't be bothered by the taste of bananas for the rest of the day. So quickly we're gonna use this taste to maybe make the banana go away. Also shake it up a little bit. Shake it up, shake it up, shake it up. gonna open the bottle. This one is actually pretty tight. Okay. Alright, so stick out your tongue. Yes. And tell me, what do you taste? Yes, apple. Correct. You're doing a really great job with that cranial nerve exam. So your mouth looks really fine. Yes, right. Yes, mint, banana, apple. You did not like banana. I'm sorry again. Okay. Yes, everything seems to be normal. So now we have come to the last part of this cranial nerve examination, which is the touching part. And for the touching part, we as doctors will wear gloves in order to prevent any spreading of bacteria or viruses. For this part, I will also be coming a little bit more close, and I will be touching your face, if that is alright with you. Yes, right, great. So I will put on these gloves. Yes, they are black gloves. We used to have blue ones and they would like match with my shirt, but sadly we don't get those anymore because the fabric where we used to buy them they don't make it anymore. So they are a little bit large for my hand. That is one hand. And now the other hand. It doesn't want to come on very smoothly. Alright, so I have the gloves on. And first I'll just be touching your face to see if there is any bumps or if everything runs smoothly across. Okay, so just be touching your face. I'll be coming a little bit more close. So your face feels actually pretty fine. I don't feel any bumps that need to concern us, so that is really great. Okay, so your face feels completely fine, completely normal. There's nothing that needs to concern me as a doctor or needs to concern you as a patient. What I want to do next is I want you to close your eyes and I will touch your face again, but this time I want you to tell me what part of your face I am touching. You know, so if I'm like touching your nose, I want you to tell me that I'm touching your nose or your ears, etc. Okay, so close your eyes for me, please. I will come again in a little bit more close and I will touch some parts. Yes, completely right. Was your right ear. Okay, next. Yes, it was your nose. Right again. Okay. Close your eyes for me, please. Yes, no peeking. Yes, your left ear. Yes, your cheeks. And now, again, keep your eyes closed. I'm almost finished. Keep your eyes closed, please, for me. Yes, your chin. And the very last part. Yes, your forehead. Alright, so great. That was everything for the face touching part. So let me take these gloves off, please. They're a little bit sticky. Put them to the side. Whoop. Okay, quickly gonna pop up my glasses again. And we're gonna check it out. Yes, everything is completely fine. Yes, no, yes. Alright, so we are done for the testing part. We did your cranial nerve exam, we checked your eyes, everything looked fine. We checked your ears, your tasting, your smelling, your touching, how you respond to that, your reflexes. You were also really good, you could tell me exactly where I was. Your diet is fine, your weight is fine, the amount of exercise you do is completely fine. I would actually say that you're a perfect human being, which is of course not really possible, but you are very healthy. Keep going like this, it's actually really great. So there's nothing to be concerned about. So if you'd like to go to my receptionist afterwards, you'll be able to make another checkup appointment with her, or if there's anything else you'd like to sort out, you can do that with her. But everything seems fine. I would like to ask you to stay safe, wear a mask right now. But yeah, you're really keep up to your great work. Everything seems completely fine, nothing out of the ordinary. My name was Dr. River. You've been a great patient, and it was surreal to work with you. Yes, and I hope to see you again sometimes. Okay, bye. Have a nice day. Oh yes, the doorway is over there, and if you walk out of the hallway, then on the right, the receptionist. Okay, bye. Have a nice day.